Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Hadeel Awartani. Today we'll be discussing heart failure, its disease pathophysiology, prognosis, diagnosis والmanagement حقته. فأول شيء we're going to ask ourselves, what is heart failure? من الاسم we can assume إنه the heart is failing at its job. The heart's job usually for us is to pump a certain amount of blood طيب, in our body, which is called the cardiac output. Usually the cardiac output حقتنا is around 5 liters. Okay? We depend on our heart to pump a certain amount with every systole into a systemic circulation عشان we get a total of 5 liters circulating at our body to meet الميتابوليك والoxygen demand حقتنا for our natural processes of life. Heart failure هي complex syndrome ما هي even though we explained it this simply, it's complex وبased في أكثر من factor going on فيها. طيب, that can result من any structural يعني any مشكلة in the structure of the heart, whether it's the muscles, any anatomical issue with the heart, or functional cardiac disorder that impairs يعني مشكلة بالactual pumping مثلا arrhythmias or something like that. طيب, that could impair the ability of the heart to function as a pump و maintain the cardiac output اللي نحتاجها. Is it rare? It's not. It's very very common. بالذات عند patients اللي they're reaching over 65 years old. This is something important to remember لأن حاليا احنا population are getting old where life expectancy حقتنا قاعدة تزيد. You will be seeing more patients بالذات إذا the risk factors are not managed. More patients will be heart failure patients in the next few years. من ناحية prognosis, outcome حقتها is poor. تقريبا نص patients that are diagnosed with heart failure are dead within 5 years. But this is important to keep in mind من ناحية the patients that you're diagnosing as heart failure know that their disease is severe. Half will be dead within 5 years. It will alter the quality of life حقتهم و their treatment will be complex لأن عندك أكثر من factor. Speaking about factors, what causes the heart failure? زي ما انتم شايفين هنا, a lot of things. A lot of things. I want you guys to remember, especially لما تيجون تفكرون مثلا exam purpose, okay? Or in real life, most common cause بالذات عندنا في السعودية هي ischemic heart disease. برضو cardiomyopathies, hypertension is a very important cause to remember, okay? وبرضو valvular heart diseases. This sometimes I like to remember things من ناحية a picture. If you're having, it doesn't have to be like this, but especially عندنا, if you have a young female, she's 40 years old, okay, فجأة she's coming to you, clear signs of heart failure. She's short of breath, she's filled with fluid, and so on and so forth. She looks heart failure. You should really think you should ask if she was a rheumatic heart disease patient in the past. But it doesn't have to be something as chronic as this. It could also be infectious endocarditis, could be mitral regurg from it. طيب, this could cause an acute heart failure from it. But these are just some examples. هذول أنا أحس they're the fourth most important to keep in mind. These you can find them بأي مرجع, all other causes طيب of heart failure, but these are the ones that you have to keep in mind. The things to remember قبل ما نكمل إنه عندنا شيء اسمها cardiac output اللي هي قلنا 5 liters و it depends على heart rate و stroke volume. Remember when we said إنه cardiac output حقتنا depends إنه we're pumping a certain amount of blood each systole, or each time our heart pumps blood, a certain amount of blood is going to go into our systemic circulation. هذه is the stroke volume. The stroke volume, if we were going to describe it, هي زي ما احنا عارفين إنه every heart cycle has a systole و a diastole. طيب, diastole هي filling stage. Okay, at the end of a diastole, your heart chamber will have the most amount of blood. This amount of blood will be your end diastolic volume. Okay, بعدين every systole في جزء من البلد اللي كانت بالventricle is being pushed the systemic circulation. This is going to be the systolic volume. So the amount, okay, then that one is the stroke volume, the one that's pushed. بعدها okay ال blood اللي left after a systole بالventricle هذه تصير ال end systolic volume اللي قبل ما تبدأ الدايستولي الثانية. طيب to get a stroke volume it's just the end diastolic volume minus ال end systolic volume كذا you have your stroke volume. The ejection fraction here is just the systolic stroke volume divided by the end diastolic. يعني فكروا فيها ال end diastolic هي التوتال. السtroke volume هي الجزء اللي تطلع كل systole or كل pump. Okay. ف numerator denominator. برضو we should remember what a preload is. The preload هي end diastolic volume at the beginning of systole. Here the amount of ventricular stretch at the end of a diastole. Basically somewhat similar للكلام اللي كنا قاعدين نقول عند ال end diastolic volume. ال preload هي the volume of blood اللي at the end of the diastole. طيب when this blood is inside the ventricle الventricle ما حتقعد بس كذا لا because you're زي ما لما تعبين بالونة تقريبا نفس الفكرة بس إنه obviously a heart is not a بالونة okay بس kind of like that you're filling the heart والventricle chamber gets stretched لأن الحين صار عندها blood ف this is the preload. ال afterload هي ال ventricular pressure at the end of the systole. طيب it's the amount of resistance the heart must overcome to open the aortic valve and push blood into the systemic circulation. Into you guys might remember من your basic years okay إنه لازم ال ventricle توصل pressure معينة طيب تصير أعلى عشان ال aortic valve تفتح جوا ال ventricle و it can push the blood into the systemic circulation. It has to reach a point where the systemic circulation pressure is lower than the ventricular pressure. فهذه هي afterload حقتنا. Okay. بعدين عندنا شيء اسمه الفرانك ستارلينج relationship. هذه it's القاعدة إنه في الهارت الطبيعي طيب when you have an increased preload or an increased amount of blood inside the ventricle stretching it طيب it will result إنه الcontractility بعدها تصير أقوى. يعني كل ما you stretched كل ما زاد البلد اللي جوا الventricle that's stretching it ال resulting contraction بعدها السيستole اللي بعدها بتكون مرة قوية. okay لما ال preload is low طيب بالrest ما حتبان الsymptoms حقت ال heart failure. okay because he's not your preload ما زاد there's no increased demand. okay your heart does not have to stretch or pump stronger and faster. ولكن لما في exertion the failing heart will produce less contractility. It will not have ال فرانك ستارلينج يعني law حقتنا اللي إنه أوكي كل ما زاد ال preload والstretch حقت ال ventricle بيزيد ال strength اللي the ventricle will contract عشان it pushes the heart the blood into the systemic circulation. But this will not be there ويبدأ symptoms okay because this blood is staying. This one is just I like this just because it really visualizes يعني طريقة symptoms. الهارت الطبيعي والfailing heart when there is no increase بالpreload okay لما في very little difference بالpreload ما حيبان طيب الفرق بالstroke volume. هذه stroke volume هنا الpreload okay normal heart والfailing heart are nearly the same. ولكن in a normal heart كل ما زاد preload the preload is getting more and more and more the ventricle is stretching طيب ف as a result contraction حقتها أقوى stroke volume حقتها تصير أقوى. okay this is gonna increase مع exertion when you're working out or so on. طيب ما حيبان this is what happens in a normal heart. That's why you don't have heart failure when you're going upstairs. ولكن patient with heart failure it doesn't matter قد إيش يزيد preload at some point the line flattens. It can't contract stronger. It can't give a bigger stroke volume to meet the demand حقت البودي. ولما this happens this is when we get symptoms حقتنا. okay Now remember قبل عشان نتعمق شوي زيادة بالpathophysiology. Remember before when we said إنه heart failure هي we explained it simply as pump failing ولكن هي complex syndrome. طيب لأن أكثر من شيء يحصل. فلما this heart fails okay من الشغل الأساسي اللي هي البامب okay في أكثر من compensatory mechanism طيب that's going to keep working عشان we keep our cardiac output the same والperipheral perfusion okay بالذات لما تصير over time that's like not just a acute setting لا ولما تكون over time your body will maintain ال cardiac output والperipheral perfusion through أكثر من mechanism طيب ولكن لما ال heart failure progresses الميكانيزمز هذه طيب ما حتكفي إنها تصلح or compensate لل failing heart وبرضو ممكن تقلب pathophysiological or pathological يعني بدال ما هي تساعد صارت تخرب okay زيادة وتزيد المشكلة الميكانيزمز اللي تكون involved بالcomplex syndrome حقتنا هي إنه during the heart failure في activation of the sympathetic nervous system في برضو activation of the renin-angiotensin system which I'm sure all of you are shuddering يعني أكيد افتكرتوها من basics برضو في natriuretic peptides وبرضو part of the ventricular dilatation والventricular remodeling كل هدول الفاكتورز they all play a role في السندروم حقت الهارت failure الحين بناخذ كل واحد bit by bit هي الصراحة من ناحية exam it's not like basics they won't ask you directly إنه إيش كانت سبب هذا or I don't it's not as likely okay أنا أحب إني أفهم these things عشان يساعدك also remembering how you're going to be treating the patient why the patient is sick يساعدك thinking how you're going to manage him correctly طيب the activation of the sympathetic nervous system okay يحصل what's the point of it إنه لما the sympathetic nervous system is activated طيب هذه increases the heart rate صح ولا لا وبرضو it will increase the strength حقت المyocardial contraction طيب this will improve the ventricular function هذه one way برضو it will constrict the venous vessels طيب so it redistributes the blood flow طيب increase the venous return when we have increase of the venous return إيش بيصير يزيد للpreload اللي قلنا كل ما زاد ال ventricle gets stretched وتقوي ال contraction الجاية حقت ال ventricle here further augments ال ventricular function via the Starling mechanism اللي تكلمنا عنه طيب وبعدين sympathetic stimulation over time you have to remember إنه it doesn't just increase heart rate increase contractility increase venous return it also has arteriolar constriction هذه مشكلتها إنه it will increase the afterload قلنا إنه عشان ال ventricle توصل pressure معينة where تكون أعلى من ال systemic circulation so our aortic valve can open and we can push the blood into it طيب this is what we need ideally ولكن when we have a sympathetic stimulation is going on for a really long time طيب it's pretty much like hypertension okay where the systemic circulation الحين صارت too high okay over ال ventricular pressure but it takes a lot of effort أصلا عشان it reaches a place where the aortic valve will open but it takes way more effort for us to pump the blood into systemic circulation وإحنا مشكلتنا for this أساسا will reduce the cardiac output طيب وبرضو it's exerting your heart even more which your heart cannot even take حاليا طيب وكذا we can close على sympathetic نيجي على renin طيب فالحين صار عندنا fall بالcardiac output طيب وصار في increase بالsympathetic tone when we have increase بالsympathetic tone يصير في diminished renal perfusion تقل البلد اللي going للكدنيز لما الafferent arteriole حقت الكدني feels إنه we're not getting enough blood it goes and starts the activation of the renin-angiotensin system اللي تطلع renin makes angiotensinogen ظاهر كانت اسمها كده طيب إلى number 1 angiotensin 1 angiotensin 1 goes بعدين عندك ACE enzyme makes it into angiotensin 2. Angiotensin 2 increases الsalt والwater retention وبرضه تسويلي constriction للblood vessels. طيب it will increase the fluid retention. والsalt and water retention will do what? Increase the venous pressure. تزيد لي volume الblood. وmaintains stroke volume by the Starling mechanism. أساس this is what it's going to do. ولكن as this increases, the peripheral والpulmonary congestion causes edema and contributes to dyspnea. ليش بتصير عندي pulmonary congestion؟ لأن قلنا الحين already our heart is not responding to the Starling mechanism. But we're having more blood طيب going in for our preload. We're not able to push enough out. فيبقى then it gets backed up into the lungs. لما it gets backed up into the lungs it goes causes يعني الإديمة. It causes fluid retention حقتنا. و gives us a shortness of breath اللي very characteristic للheart failure. برضو angiotensin 2 will cause زي ما قلنا arteriolar constriction. و this will increase afterload and the work of the heart. نفس فكرة يعني same way as sympathetic nervous system برضو angiotensin 2 تسوي نفس الشيء. It will increase afterload. بعدين نجي لnatriuretic peptides. الصراحة there's أكثر from as you can see أنا ضايفة أضفت atrial type والbrain type و then the third type لأنها كانت بالمرجع. ولكن اللي يهمك أنتي is the brain natriuretic peptide or BNP لأن this is the one that you're looking for بالheart failure patients. Okay. فائدتها إنه it has a diuretic natriuretic يعني it is moving out salt. Okay. Na plus. طيب. وhypotensive properties تقل الفوليوم حقتي. الeffective الأكشن حقتهم it can be beneficial ولكن it's not enough. طيب to reduce cardiac load حقتنا اللي احنا we're struggling with right now اللي هي preload afterload اللي both of them زايدين واحنا منا قادرين نتعامل معاهم. Okay. برضو there's another one يعني this is just for you to know there is pro BNP. طيب و BNP كلهم they're نفس الفكرة you measure them later on. طيب it so apparently يعني correlates with the severity of heart failure. طيب و they can be predictors للcardiovascular events و mortality. برضو some people like to use them to monitor heart failure therapy يعني if they're improving. طيب لكن أنت remember it because هذا بيكون ضمن الأشياء you will order for diagnosis. Okay. Now you know what it's supposed to do. These three things. That's why it's good. وإنها compensatory mechanism ولكن ما تكفي. بعدين نجي على ventricular dilatation والremodeling. طيب من ناحية dilatation لما عندنا failure بالميوكارديوم معناته إنه there is a reduction بالvolume that is ejected مع each heartbeat يعني stroke volume تقل. و that means إنه there's an increase بالvolume of blood اللي تبقى بعد كل systole يعني end systolic volume تزيد برضو لأن هذه قلت. طيب the increased diastolic volume stretches the myocardial fibers. What they mean by that إنه الحين قلت عندي الستروك فوليوم حقتي فبقى عندي end systolic حقتي صارت أكثر. مثلا كان أول 4 والحين صارت 5. This is purely just numbers just so we can understand what they're saying. Okay. This is 5. تيجي الدياستولي. Okay. وقت الدياستولي وتقعد تعبي فوق 5 اللي بقت اللي أول كانت 4. Okay. فهذا زاد 1 basically right. Anyway فصارت end diastolic volume حقتي أكثر من أول لما stroke volume كانت أحسن. Okay. فالمفروض إنه my ventricle is stretching even more. Because I'm having Starling's law it should mean إنه المyocardial contraction حقتي ترجع أقوى. Okay. وتصلح لي الstroke volume حقتي. ولكن لما I have heart failure قلنا إنه this compensatory mechanism حقت الستارلينج will not apply. وبكذا في ال stretching يصير في cardiac dilatation. okay, it's limited by the flattened هذه ال flattened contour. تصير هذا بالضبط، تصير الشكل هذا. okay, فلما this happens okay زي ما we started talking about بالangiotensin بالرنين يعني بالangiotensin system إنه يصير في increased venous pressure. طيب و this will contribute للdevelopment بعدين للpulmonary والperipheral edema الascites والlower leg edema shortness of breath. طيب in addition as ventricular diameter increases يحتاج greater tension عشان we contract the myocardium to expel a given volume of blood و oxygen requirements increase. هي نفس السالفة إنه we're trying to fix it بس إنه we're actually making ourselves work harder. okay, بالremodeling they're talking about hypertrophy حقت ventricles loss of functional myocytes increased fibrosis. طيب this will all contribute إنه يصير فيه progressive و irreversible pump failure يبطل able to contract efficiently. البروسيس حقتها is multifactorial وضمنها في apoptosis of the myocytes و changes بالcardiac contractile gene expression. Annie, you don't really have to know it here. Okay, what I like about this figure, it basically summarizes كل اللي قلناه. طيب in a really simple way. In heart failure we have a decrease بالcardiac output. When that happens, two things happen for me. في activation of the RAS system وبرضو activation of the sympathetic nervous system. لما this happens بيصير عندي systemic vasoconstriction وبرضو fluid retention. لما that happens my venous return increases. لما ال venous return increases عندي bigger preload. When that happens my cardiac output تزيد again و becomes maintained زي ما أحتاجها. ولكن بالheart failure وكل ما زاد الheart failure this increased preload does not result in an increased cardiac output. It does not get corrected because the Frank-Starling mechanism stops working. كل ما زاد preload ما حيزيد كل ما زاد preload ما حيزيد عندي contractility. It'll stay the same. بيصير عندي flattening curve حقتي. okay, when that happens بيصير عندي increased end diastolic volume left ventricle because I have more blood in my ventricle. The pressure جوا ventricle زاد. When that happens the pressure means إنه the blood moves back to the pulmonary veins. This gives me pulmonary congestion symptoms which moves into shortness of breath حقتي. فthis moves symptoms نتكلم عنهم. Big ones, the ones that you always have to ask any cardiac patient, you have to ask if they have shortness of breath upon exertion, shortness of breath that is positional when they're lying flat on their back, paroxysmal nocturnal dyspnea, which means they have been awakened from sleep. okay, because of it احنا نفتكرها as PND. طيب and this is the abbreviation we always use, it's PND. والfatigue حقهم because it's a lot of things are going on. الsigns اللي ممكن طبعا في أكثر but these are the cardiac ones that you have to mention دايما. okay, برضو لأن this also indicates the severity حقتي. بعدين أجي أشوف الساينز إيش اللي أنا حشوفها على البيشنت اللي he is having heart failure. He will be tachycardic لأنه he's trying to compensate because زي ما قلنا هنا. طيب إنه عندي congestion بالpulmonary veins. okay, كل كذا اعتبري إنه all the blood got backed up. okay, في ال JVP حقتي ال jugular venous vein remember عندي right atrium وش اللي قاعد يدخل for it ال inferior vena cava وبرضو ال superior vena cava. superior vena cava feeding into it ضمنها ال jugular vein. This whole system now is getting backed up. The blood isn't moving قدام. everything is going ورا. فعندك ال jugular venous pressure will be higher. بتلاقين كذا distended neck vein. Okay, لما you do a physical exam و you measure it من عند sternal angle and all that انت you're seeing the highest point قد ايش يوصل. It's gonna be bigger و bigger باللي fluid overloaded. When you feel for the apex beat غالبا بتكون displaced لأن صار عندك cardiomegaly فتتحرك الapex. ممكن تلاقين third heart sound. ممكن تلاقين bi-basal lung crackles لأن قلنا في pulmonary congestion فصار في pulmonary edema, but you will hear it in the lung bases. برضو you might have pleural effusion, وهذه الأنكل edema pitting edema اللي تشوفينها in the lower limb. Okay. برضو you will find it sacral in bedbound patients. لازم تشيكين each cardiac patient حتى respiratory patient you will check for peripheral وبرضو sacral edema. Don't forget to always check for sacral edema. Okay. Also it could lead to ascites وtender hepatomegaly لأن زي ما قلنا إنه it's not just being the blood isn't just being pushed up into the SVC, it's also being pushed down the IVC. So you have fluid overload من both جهات. Okay, what will be affected is the liver. بعدين كده نازل, literally it just goes down as a line. Okay, but that's why you have all these symptoms. هنا this is something that يعني classification of left-sided heart failure or right-sided heart failure اللي فهمتها before إنه cardiologists don't like it as much, ولكن في some symptoms that are يعني إذا سألوك بالBST round or whatever, you know, what would you consider to be a right-sided heart failure symptom or left-sided? Sometimes يحبون يسألون هالأسئلة. ف right-sided, you're gonna have ascites. You're gonna have enlarged liver and spleen. Maybe secondary, يعني إذا أحد قال لك إنه this patient is secondary يعني عنده COPD فهي or he has pulmonary hypertension. Okay, pulmonary hypertension صوت له cor pulmonale. هذه it's very specific. Cor pulmonale is when you have heart failure due to secondary to a respiratory cause. فصارت كل right side حقت الهارت خربانة و it's giving you heart failure symptoms. Distended jugular veins اللي قلناها اللي تكون huge هنا, you can see it in the picture. Okay. Weight gain هذه nice because actually this is important to remember when you're taking history من any heart failure patient. احنا متعودين من constitutional symptoms we always ask did you have weight loss. بالheart failure patient you have to ask about weight gain. In general, if you have a patient who is having fluid overload, he's gaining fluid, you have to ask how much weight did you gain because that's all fluid. Okay, you'll ask نفس الفكرة إنه how much do you gain over what, did you increase your appetite ولا لا. أصلا in the patient that is heart failure he'll say لا أنا مو قاعد أكل بس فجأة كذا سمنت. Okay, و dependent edema which means إنه بداية إنه يكون منسدح ما في شيء. Okay, that's why we also said you check for the sacral edema because when you're lying down, okay, the fluid كلها kind of moves down with gravity. Okay, فما حتلاقينها in the regular area where you check in the leg إلا إذا كانت obviously very severe, but you will find it in the sacrum. و the patient will tell you إنه for me my legs swell نهاية اليوم. بداية اليوم ما في أي مشكلة because هو منسدح. طيب فكل الفلويد it's like كل الفلويد with gravity is pushed يعني كأنه it's pushed down here like هو منسدح كده for the water is all here. Once he stands up the water goes down و throughout the day كده as the day goes by فجأة كده رجله يكبر. Okay, because كل الفلويد is moving down again. Okay, this is a classic picture. Every slide has had it. Left-sided هذه you will find the pulmonary edema symptoms very characteristic فيها اللي هي you'll hear برضو بتسمعين إنه عنده frothy pink cough. هذه هي السبيوتم حقته. His symptoms come while he's lying down. Exertional dyspnea اللي احنا we're used to hearing it. Okay, هذه paroxysmal nocturnal dyspnea اللي waking me up when I'm asleep. ايوه طيب what's interesting إنه you have to keep this in mind إنه left-sided or right-sided, usually you'll have it will be hard for you. كل patient you find only left-sided symptoms or only right-sided. Usually left-sided happens. كل ما you stayed with left-sided makes right-sided. بعدين you have symptoms of both. Okay? هنا برضو it's another picture. So you can find 1,000 pictures, honestly, talking to you about what's the left-sided symptoms, what's the right-sided symptoms. برضو what's important about that is because لما تاخذين history, لما تقدمين case, okay? When you ask about the shortness of breath, you have something called the New York Heart Association classification. طيب. You try to understand قد إيش this patient is suffering بالshortness of breath حقته. If it is not limiting him, طيب, at all, هذا class 1. طيب. الnormal does not. بس لما extreme يجيله symptoms, هذا يصير class 1. Class 2 عنده mild limitation. He's comfortable at rest, ولكن normal activity produces fatigue. يعني he's not doing extreme activity, ولكن he is feeling the symptoms. 3 عنده marked limitation أثناء الأشياء الطبيعية، إنه والله أنا بس قاعد أقوم أروح للحمام، أنا بس أبغى أمشي من غرفتي للمطبخ، قاعد يجيني السيمتومز، okay, ولكن لما أنا مرتاح ما يجيني شيء. This is class 3. وclass 4 is symptoms of heart failure. حتى وأنا جالس I'm just sitting كذا عادي و I get my symptoms. هذا heart failure class 4. When you're taking a history and you assess يعني قد إيش this patient is limited, when you're presenting it, you will mention what kind of class of heart failure he is. What's also important with that is because في طريقة المانجمنت برضو ممكن يفرق معاكي. Okay? So keep that in mind. We'll get back to it لأن حاطة slide كمان عليه. We'll talk about it later. طب نجي على Okay. فنجي على diagnosis. Pediatry, we'll get back to it. ولكن in general, some things that you will order when you're suspecting heart failure, you will order a chest x-ray, EKG, في أكثر من blood test you will order. هذا BNP حطته بالأحمر. I just switch that لأنه مهمة. Okay. Echo. Okay. It's really important. وذن في أكثر من other tests you could use. Cardiac cath, nuclear, ventriculogram. أنا بس حطتهم because now we're going to go into each one. Okay. شيء بالأوزلر that they will ask you or long case or OSCE. Whenever you say that you're going to order something, لازم يكون عندك سبب. Okay. So you have to remember why. Okay. Chest x-ray, why do I want it? I want to see pulmonary edema. I want to see إذا في pleural effusion. ممكن يطلع لي curly B lines. طيب هذه حقت pulmonary edema, effusion. برضو يمكن cardiomegaly. EKG ليش أبغاها؟ يمكن لأن قلنا إنه من one of the most common causes حقت heart failure هي ischemic heart disease. فهنا بلاقي proof of past ischemic heart disease ولا he is currently having أصلا ischemic heart event. طيب ولا حتى يمكن يلاقي لي arrhythmias. طيب which is causing it. ممكن blood. هنا I want you guys to have a reason for each one. Anyone asks you why are you ordering this, you'll say why. But I would not order all of them as initial. طيب إلا BNP. بنرجع BNP. CBC you would order it لأن في أكثر من شيء could cause exacerbation للheart failure. ضمنها severe anemia. Okay. So you will check. برضو لأن ضمن differential diagnosis for you as a patient coming to you with shortness of breath, with a cough, whatever, you're going to assume إنه يمكن يكون respiratory. So you will also do chest x-ray, CBC. You're ruling out pneumonia, ruling out infection. LFT بعدين you will check it عشان to develop because حسب LFT حسب to create a baseline للpatient. برضو urea و electrolytes لأن I'm going to start giving him diuretics. This is moving into management. بس يعني for your option, for your reasons. Thyroid function test لأن severe thyrotoxicosis can cause heart failure. Blood glucose لأن you are going to be managing a comorbid patient. غالبا يعني if he's hypertension or IHD he might have diabetes, فيل check that. ال BNP, okay, let's say إنه عندي patient الحين he is suggestive إنه heart failure. I don't have enough time إن I do for him echo, which is the only thing that will accurately tell me إنه هذا heart failure or tell me how it is heart failure. Okay, echo takes time. I can't just do it in 2 seconds. صح؟ بس هو جايني he's shortness of breath, he's got fluid overload. أعرف إنه his history he is past he had IHD or this is like his 3rd time coming or whatever طيب with similar symptoms. أعرف إنه غالبا this is heart failure. I would order a BNP. ليش؟ لأن BNP حقتي إذا كانت لأن BNP there's أكثر من شيء ممكن يرفعها طيب ولكن a BNP less than 100 almost completely cancels out possibility إنها cardiac. okay, فوق 100 or like فوق 400 فوق رقم يعني أسطوري lets you know إنه okay this is cardiac وغالبا this is heart failure. على بال ما يطلع لي okay, على بال ما I stabilize the patient enough إني أسوي له echo. okay, برضو I'll do an ECG so it tells me if like past events. ال CXR زي ما قلنا to rule out other causes as well. Echo is the only thing for me to fully هذه هي best initial test بعد ما you manage the patient, stabilized him, تسوين له echo to diagnose the heart failure. ميزتها بيوريك ejection fraction حقتك so that you know how severe is his heart failure. Pulmonary artery pressure, diastolic function حقت الheart. عشان we get more specific, if they say what kind of echo, you say transthoracic. TTE. مو TEE حقت AFib, لا TTE for heart failure. Okay. You can do cardiac cath if you want to مثلا see if this patient is having it due to ischemic event. Okay. This will show you فين. Okay, this is going to change in management حقتك as well. If they asked you what would be the most accurate test, it is a nuclear ventriculogram. بس شخصيا ما قد انسأل لي what is the most accurate test. بس what would you do? I always get by with echocardiogram. Initially I would do BNP, I would do CBC, I would do EKG, I would do chest x-ray. هذه كلها like very fair answers. No one will fault you for saying them. Okay. إذا مثلا they said choose one, choose the echo. Okay. هنا في tree. Literally just saying what we said, which is, you know, there's a patient, we're suspecting them of heart failure because of his symptoms with signs ماشية مع heart failure. I did ECG و CXR وال BNP عشان أشوف إذا في things suggesting cardiac disease. Obviously if this is no, most likely ما في heart failure. ولكن if it was abnormal, after I managed him or stabilized him الأصح و I have time إني أودي, I found for him opening يسوي echocardiography, I will do echocardiography. ليه? Because I want to see what's going on. I want to see the ejection fraction, I want to see the diastolic function حقت الheart. بعد كذا I can assess the etiology حقتها with the left cath, to see how much it is, إيش ممكن سببها. طيب, what is the type of cardiac dysfunction which goes into another type of classification of heart failure. وبرضه ممكن any other additional diagnostic test that you want, you can order it. Then you will choose the treatment based على 2 different ways. So we'll get back to it. This is what I wanted to say. الcardiac dysfunction حقنا هل هي systolic, this is another classification. هل هي systolic ولا diastolic heart failure. We mentioned إنه في right-sided و left-sided heart failure. برضه they describe things as systolic or diastolic, or systolic, which is heart failure with a reduced ejection fraction, and normal ejection fraction تكون الظاهر I think between 50 to 70 ولا 45. I think it's 50 to 70. Okay, 50 to 70%. طيب, فباللي عندهم systolic dysfunction ejection fraction حقتهم تصير أقل. And I put these in green. I'm gonna keep them in green. Okay, ejection fraction is less than 40%. كيف يكون شكل الهارت؟ تكون dilated, thin و floppy. Because of that, it is too weak to properly pump the blood. Okay? Too weak to give me the stroke volume I need. Okay? During a systole. Main cause of this, ischemic cause. You can assume بما إننا قلنا إنه ischemic cause هي most common cause، صح ولا لا؟ للheart failure. You can also think إنه okay, heart failure with reduced ejection fraction برضو is probably more common. Well, you wouldn't be wrong for thinking that. Okay? I mean, I don't think so anyway. بس yeah. نيجي على diastolic. Okay? Heart failure or heart failure with a preserved ejection fraction. يعني ال ejection fraction حقتنا is still normal. ما صارت أقل من 40. ال ejection fraction I keep coloring over it. Anyway, ejection fraction حقتنا هي يا إما نفسها يا إما حتى تزيد. ليش بتزيد؟ لأن my heart is hypertrophied. It's unable to relax. طيب أثناء ventricular filling أثناء diastole. لأن قلنا إنه بالdiastole heart is relaxed، صح ولا لا؟ We have a filling phase. If the heart is tense, pressure is not completely less من الهدف. It will have incomplete filling, or the filling حقتها will not be as efficient. في amount of blood اللي عندك بنهاية diastole ما حتكون as much as you need. Okay? even though your contractility is يمكن normal أو حتى too strong, okay, للكمية of blood you have, you'll have less cardiac output لأن your end diastolic volume قلت. طيب cause for this is hypertension. ليش؟ لأن عندك left ventricular hypertrophy. Okay. بعدين الحين now we're gonna talk about the reason I brought up this إنه في systolic versus diastolic لأن في management في two ways to memorize the management. Okay. في by the New York Heart Association class هذه in all honesty تبع online med ed. I like it. It helps me remember it. في برضو by السيستوليك والdiastolic. Okay. هذه تكون شوية more complicated ولكن إذا ماني غلطانة هي السيستوليك. Okay. This one, like I think this figure almost exactly موجودة بالسلايدات. يمكن لا، يمكن تغير سلايداتكم بس إنه I put both. We're going to talk about both for the sake of covering everything. Okay, let's talk about the management حقتنا by a New York Heart Association class. This is the one that's explained in online med ed. On the left هنا I have كل drugs that are mentioned فيها, which is beta blockers, ACE inhibitors, or ARBs. I don't remember the actual name. This is ARBs. Loop diuretics اللي زي furosemide, spironolactone, hydralazine and isosorbide dinitrate, وionotropic agents زي digoxin, dobutamine, or milrinone. طيب. We'll do something really cool, which is coloring. Okay. For lifestyle, anything in purple, okay, we're going to make it حقت class 1. طيب. اللي حلو في this إنه anything that class 1 gets برضو class 2, class 3 و class 4 will have as well. Okay. This is true for all of them. يعني whatever class 1 gets, if he's class 2 he'll have أشياء class 2 زائد class 1. If he's class 3 he'll have أشياء class 2 class 3 وبرضو حقت أشياء class 2 وبرضو حقت أشياء class 1. If he's class 4 he'll have حق كلهم غير حقت class 4. طيب class 1 بنخليه بنفسجي. Everyone will have lifestyle modification أهمها smoking cessation, salt restriction to less than 2 grams per day, fluid restriction to less than 2 liters per day. هذه important to mention أثناء your OSCE, your Osler. Okay? Everyone will have these. برضو they will have with it beta blockers ولازم ياخذوا معاها ACE or ARB if they can't tolerate the ACE. طيب نيجي لclass 2. Let's make class 2 yellow. Anyone who's class 2 قلنا الحين he's comfortable at rest, عنده mild limitation. During the activity he has fatigue, dyspnea, palpitations. He has symptoms. Anyone who is class 2 in yellow, what is going to manage my symptoms? الdiuretic. Lasix. Remember, this is the most effective عشان يريح البيشنت حقي من الsymptoms حقته of shortness of breath, of the pulmonary congestion symptoms, okay, or fluid overload symptoms, the diuretic. Then for class 3 we'll make them, let's make them blue. هنا زاد شوي. Okay. هنا it's a little bit annoying, but basically for anyone who's class 3 you'll add spironolactone. And if he's still symptomatic, you will also add الhydralazine والnitrate, okay, isosorbide dinitrate, okay. I just put that as ID, okay. الحين وصلنا, now we're going to use orange, okay. Class 4, which is the strongest, the worst, okay. In orange, anyone who is class 4, اللي بيزيد عليه إنه he will also have inotropic support, يا إما through dobutamine or digoxin or milrinone, okay. Okay, let's see it again كده مع colors. I hope it's actually useful and I like it in colors. Anyone who's any heart failure patient will have everything in purple. Anyone, لو إنه he's heart class 4, class 3, class 2, class 1, they will all have everything in purple. When he's in class 2, he'll have everything in yellow and purple. When he's class 3, he'll have everything in blue, yellow, and purple. And when he's class 4, he'll have everything orange, blue, yellow, and purple. Okay? بعدين نجي على how we will manage each patient if they are systolic or diastolic. هذه اللي بالسلايدز. أنا حبدأ بالdiastolic لأنها أريح شيء صراحة. It's the easiest. Diastolic ما لقوا شيء that will actually improve المورتاليتي والmorbidity حقتهم. فهي التريتمنت حقتها is purely symptomatic. قلنا أهم شيء first symptoms is الdiuretic حقتي. Okay. الdiuretic حقتي is going to improve the symptoms. Why am I getting my symptoms? لأن I'm having too much preload, okay, too much fluid. How did that happen? الpreload حقتي is too much مقارنة بالactual ability حقتي إنه I push it out, صح ولا لا؟ I'm having backup of الفلويد. فهنا ميزة ACE والARB وبرضو الهيدرالازين والisosorbide dinitrate إنها كلهم ACE والARB we know its role حقتها blocking الRAS system, okay. So this is going to eliminate my increased fluid و it'll ruin الفixal afterload issue. طيب بعدين حاجي for these two, this is a venodilator. I think إذا ماني غلطانة برضو الراس كان عندها علاقة بالvenous return as well. When I have venodilation, I'm not pushing the blood into the venous system and pushing it into my right atrium and pushing it into my preload. لا خلاص, I'm trying to dilate the blood وكذا suck it back in down ويقل لي preload. My preload will decrease. فهذه هي فائدتها. And it's basically you're trying to get هنا you're treating a symptom وهنا you're trying to stop the symptoms happening. طيب this is to stop a symptom, this is to stop the symptoms happening، بس هي كلها focused على symptoms. okay. نجي على systolic. systolic شوي سالفة. symptomatic everyone will have، يعني كأنه he's saying إنه كأنه he started us from class 2. okay. بالNYHA. okay. He will have diuretic, ACE inhibitor or ARB if he can't tolerate ACE و beta blockers. Let's say إنه he's still symptomatic. okay. I يعني remember this just for one case ejection fraction، بس إنه أنت اللي يهمك symptoms. He's still symptomatic. I add spironolactone. كأني قاعد أقول I'm treating him as though he is class 3. okay. He's still symptomatic. هنا يختلف شوي. okay. هنا okay. If he is already tolerating the ACE inhibitor or ARB, I'm gonna take the ACE طيب remove it completely. طيب. Oops. Nope. I'm gonna remove the ACE completely وأحط شيء اسمه أرني وأخليه ياخذ أرني مع ARB. طيب برضو I'll look here إذا هو مثلا he's having sinus rhythm بالEKG والQRS interval حقته is أكبر من 120 ملي سكند I'll consider CRT. ايوه فزي ما قلنا this would be cardiac resynchronization therapy. برضو then you'll check if someone has sinus rhythm ولكن their heart rate is more than 170 beats per minute. هنا option is ibuprofen. All you have to know targets sodium channels or funny channels بالأساي نود box it و it reduces the contraction. طيب برضو these three can be combined. Let's say he's still symptomatic. My next options are hydralazine, we know this one, with digoxin. Okay, الhydralazine والisosorbide dinitrate. With digoxin, we know this option. Yeah. But there's this no, honestly, like to be perfectly honest with you, I remember mainly solving questions based على this way. Okay. Well, I did not have an issue. And I'm only mentioning this because of, in all honesty, this medication or this فكرة combination, it's good to know. Or this. Yani, if you can find a way to think of it, it's kind of like they added, a step between class 3 or 4 they added and they moved hydralazine من class 3 اللي كانت spironolactone خلوا hydralazine هنا طيب مع class 4 كأنه they made this class 4 طيب basically and then they made this class 5 اللي هي كانت class 4 أول طيب with other options. okay. بس إنه these two cause this one الحين بنرجع نقول ليش. okay. This is different here really it's these two. okay. اللي هي معاها. I hope that makes sense. بس لما we do this we're gonna get to here. هنا it's just a note من online med ed. If you have a patient with ejection fraction less than 35 ولكن he is not New York Heart Association class 4 يعني he is not having symptoms at rest, you'll do an automated intracardiac defibrillator. طيب برضو من online med ed, what if the patient حقي is also ischemic heart disease مثلا سويت ال ECG ولقيت إنه he's having STEMI right now. okay, but he is, what am I gonna do? Treat him as STEMI أول شيء. He does have heart failure. فضمن المedications اللي بعطيه for his heart failure I will also add statin و aspirin. okay. هذه something for you to remember, because why are we saying, oh, I'm going to use defibrillators, I'm going to use resynchronizing ومدري إيش? Because the most common common cause of death بالheart failure patient هي sudden cardiac death. Okay? If all treatments fail, the final resort is to do heart transplantation. طيب هذه take it as note حلو. The way I explain this, it's just a way so that you can maybe remember it similar to how it's easier to remember this, but try to like add it too, you know. نيجي الحين نتكلم عن acute decompensated heart failure, because قلنا heart failure لحالة it's a whole syndrome وتكون chronic, ولكن في exacerbations where it's acutely decompensated. البيكتشر حقك بيكون acute dyspnea started suddenly, ممكن يكون عنده pulmonary edema, ممكن لا. هذه just a note إنه إذا قالوا لك what is flash pulmonary edema, it's severe form. طيب عندك rapid accumulation of fluid in the lungs, which is not really that important. خذيها as just a fun fact. Differential diagnosis for someone coming with acute dyspnea, PE, asthma exacerbation, pneumonia, all of these can cause rapid respiratory distress. Diagnostic test that I'm going to use is going to be an ECG. It's going to be a chest X-ray, ABG, BNP, echocardiogram or coronary angiogram if indicated. هذه قلنا ليش؟ لأن إذا هي كانت وهذه قلنا ليش؟ هذه ليش؟ We said these are all this BNP if it's less than 100. If here I see findings that are showing me مثلا consolidation, عندي ال ABG is indicating إنه هي respiratory cause. كل هذه is ruling out إنها cardiac. If this was مثلا ST elevation, okay, هنا I will think إنه oh, this could be causing a heart failure exacerbation. This is important to know لأن برضو this is going to change my management. Echocardiogram و angiogram طبعا أنا ما أقدر أعطيه when he is in acute setting, بس إنه I will do it if it's indicated و he's stable. هنا نتكلم عن causes of acute heart failure. What can exacerbate? في كثير, ولكن here are some important ones that I have been asked before أثناء اختبارات, أثناء Oslers or whatever, and what could cause it. It is asked. An important one is ACS or MI. برضو very very important, non-compliance. Someone who's not compliant, مو فقط المedications, برضو lifestyle management, لأنه قلنا في ضمنها smoking cessation, fluid restriction, sodium restriction. كل هذه can cause exacerbation or acute heart failure. Infection, including infective endocarditis that we said can cause mitral regurg or cause acute heart failure. This is important, especially إذا عندكم الHarveys or you're doing Oslers. Keep that in mind. Arrhythmias can cause acute heart failure. A COPD or asthma exacerbation. Severe anemia زي we mentioned و thyrotoxicosis. حلو. نيجي على المانجمنت. Management, really nice, simple, is LMNOP. Loop diuretic, قلنا symptoms حقي get solved with diuretic. Most important one. Morphine و nitrate لأنهم both count as venodilators. Both will decrease my preload and result in overall less work on the heart, who's أصلا becoming symptomatic لأنه he is overworked. أعطيه oxygen. ليش أعطيه oxygen؟ لأن point of it إنه his heart is failing at meeting the demand حقه for blood. Blood وش فايدتها؟ It's moving the oxygen. صح ولا لا؟ و other things, بس in this case oxygen, that's what's really important. But you give supplementary oxygen, but that if you find he's destatting when you check his vitals. Position, مو قلنا إنه a heart failure patient will have symptoms when he's lying down flat on his back. هذه هي orthopnea, literal definition of orthopnea. what relieves it is sitting upright مع legs dangling over the bed لأن decreasing the preload gravity pulls the blood down للفيت. okay, won't go up as much. طيب بس هي أهم شيء sitting upright، هذا أهم شيء. okay, هذه very important. It's good to mention أثناء المانجمنت. okay, وبرضه يعني if you found the underlying cause you treat that as well. وكذا we finished the lecture. references that I use طبعا في my own experience بالكلية. I used Pocket Kumar, Step Up to Medicine, Master the Boards, Online Med Ed, Osmosis Clinical. ولكن I don't recommend إنه you all use every single one of these when you study it. بالعكس I just did it لأن I'm giving a presentation I chose bits and pieces of each thing that I like to give it in a way that I can make it beneficial لكم. For you, you're studying, choose 1-2 max stick to them. مو لازم تبدلون كثير. يعني just because I added all these بالlecture مو معناته إنه this is what you should do. okay, وإن شاء الله يعني this was beneficial لكم. طبعا أعتذر إذا في أي أخطاء وبالتوفيق لكم كلكم. I hope you enjoy third year.